Welcome to the village.
Another thing also in terms of when I joined CMB here, they started sending volunteer. I learned also a lot from them. I remember one of the nurse called Caroline.
Okay.
We learned a lot from her. She normally, even if she did not tell you, you can watch her. There's nothing, maybe you'll fail maybe for work. Sometimes maybe your mind is tired, you give time to rest, but she's persistent, continue doing. Persistent. Sometimes the whole day. Telling, because sometimes we are thinking, you coming maybe from developed country, you are not working like us. But wait, if someone is working like that, meaning it is also there is a need when you concentrate, maybe you focus on your work, it's really mean a lot. Meaning, if any chance also, we go also maybe in developed country also, we can also manage, because we have seen then one of the Australia, those guys who came and fixed the solar.
Yeah.
This solar here, you will not believe their work. They work like even some of what us here, they can say maybe, this kind of work is dirty work. Get someone come with the clean clothes, dirty opening a hole, like 50 centimeter, digging a hole.
Yeah.
We have seen here. I also really became motivated when the CMB continue also sending volunteers. We also learn a lot from them. Hardworking, learning also new things. You are also one of them. We normally, though maybe the guidelines say maybe the issue of sometime maybe flutes, giving flute especially, it is so restricted, maybe included some of also our medical officer. If anything, especially in anemia cases, we normally fear this heart failure, whatever. But sometimes when you arrive, you introduce also a flute maybe in situation of severe pneumonia, severe anemia after maybe getting blood transfusion. We learn, even if the fluid is being given, you say maybe 2 to 3 days, the person improve. That is also, we learn a lot of things, especially me, I learn a lot of things. Then if any time, as I mentioned before, then if I do upgrading, then I'll be very happy. Yeah.
Yeah. It's always good to further and keep trying to achieve your goals.
Yes.
And help people.
Yeah.
Yeah. Thank you so much, Richard.
Thank you.
You have so much experience and wisdom in your life. You can move on to Bonface. Are you ready? Wanted to first, we talked about some of Richard's family and we talked about some of how you came to be here. So I know there's some things here that frustrate you, whether it's this hospital or this town. What is it that you want changes either here in your life, and why?
Yeah, thank you for the chance. I would like to talk about some of the few things, either negative or positive, which all brought this in my life. So at one point, when I was young, some of the things which impressed me to think about medical school or anything to do with health. When I was young, I was bitten by a dog. In 2005, by then I was 9 years, even it is here.
Oh.
It was dog which cut this nail of mine. I was still young, so it was hard. By that time, there was outbreak of rabies.
Yes.
So we were in the village with my dad. My dad was a nurse, community health worker. But the facility where he used to work in, it never had those things of anti-rabies. So it took us time to get to Yambio, whereby I got the vaccines. Most of the people whom the dog bite us with, they died.
Wow.
So there were like one dog bite us, we were 5. 2 were my age mates. Then I became the only one who survived because my father was in health. So he had to take me to Yambio PHCC. That was where the vaccine was. So they gave me the vaccine, then I became the only survivor. So now this one came into my mind that if my dad would have not have the knowledge, by now I would have been dead.
Wow.
So it made me really to think about it.
Yeah.
Then when I joined St. Theresa, I joined in 2018. That was the same year I finished my senior 4. It had been in my mind because I survived death. It has been in my mind that I have to work for the hospital. When I finished senior 4, it took me only 1 month. Then I applied to come here as a student trained on job. By that time when I was here, I got some of the volunteers from CMB. One was Dr. Matthew, who came from Wales. Then there was Sarah, the midwife, and her husband, Martin. So these people, we worked with them, especially Dr. Matthew, he could give advice, we worked with them. They really impressed me. So I think those people, they really motivated me to join that work. And when I was sent, I was really very happy. Even we used to communicate still with Dr. Matthew. So about my life has been so interesting and challenging. Because if I can remember, I am from extended family. My dad, likewise, also, he was in polygamous marriage. He had like 3 wives. So among all those, we are very many. I am the only one who is educated. And then the challenge in the community in the family was paying who to school and leave who, because the children were many. It was only my mom who was struggling with me when I was doing primary school. What I realized is commitment is the best thing. When you commit yourself, good things can come your way. When I was at school in primary, I was committed. I used to read, I used to follow what has been said. Then one of the Komboni sister picked interest. She said she wants to further my schools in secondary school. She took charge of me in secondary school from senior 1. Her name was Sister Azucena. She was from Mexico, yeah. She started paying me in first year, second year, third, and up to senior 4. Just free of course, because she asked me that, Boniface, she sees I can do something, and she is planning to pay me. Is there anyone in the family who can pay my school fees without being discommunicated? I explained how my family is and some of my elders, what made them not to finish at least senior 4. So she decided to pay me to school. So I finished senior 4. She was not by that time there. I tried to communicate with her until I saw her just this year in June. I tried to thank her, but I had no way of communicating with her. By that time, we did not have phone wherever we could share contact. So I just saw her just this year. Then I thank her. Then when I joined also here in St. Theresa, I think through the commitment, and then also God does not leave the one who is really in need. Because when I came here, I was working, I tried to commit myself, then also I got chance from the sisters also here, then they sent me for studies. So all in all, my life has been contributed by outsiders, in which I thank God for that. Some of my family members, they didn't do much apart from advice. But supporting me professionally, it has been from different people, and really I thank God for that. And then I always have one principle that whenever you have accepted to do something, commit yourself and do it with interest. When you do good things are on your way. So I'm really happy about how my life has been moving on. So I still have dreams. I still have dreams or expectation, because I only have a diploma in general nursing. There are some of the interests, like especially our hospital here. It does not have ICU nurse. I think if there is ICU nurse here, the ICU nurse can take both medical side and pediatric side's conditions as per now. Even if we don't have a qualified nurse in a theater, a surgical nurse or a theater nurse, that one is not here. The theater is being run by attendants, theater attendant. I really, especially things to do with children like neonatology, like for Ashley, this position of her really is really needed in this hospital. So we really thank the volunteers from CMMB because most of the things, the new things we are getting through them. We are getting through you. Like you coming in, Ashley coming in, even those of Dr. Matthew and Sarah plus Caroline, even Brooke. Brooke was here. So each one of you, when you come in, we can get something. We have to get something. Like especially you and Ashley. You came in when you were really in need of help. And then we have got the help. Children were dying, especially during the time of measles. People were dying. But with your introduction on the ground, there are some of the things we used to fear, more especially giving IV fluid to kids. But when you came in and introduced it, now we can go 2 weeks, 3 weeks with no death case, which means if you will have not come on ground, we were to still remain behind with the knowledge of fearing with what can help. So through you, really, we are really improving. Especially you came in with the sessions which we are having every Tuesday. At least it is making us updated because every Tuesday you can bring in a new topic we discuss. You can remind us of what we read or what we never read. All those things are for the benefit of our children and our patients. The life has been so challenging and interesting to my side.
To see nurses like you and Richard, I feel like when we're explaining, actually somebody's listening. It's hard to actually get someone to accept a change and make the change and know it will happen. But like Ashley and I both think when we are talking to you and we ask you for something, we know that you're dedicated, you're doing the work and you're using the charts and you're giving the medicines and you're doing everything. And it's really tough to make changes because if someone is working one way and then someone from out of the country comes and tells them, actually, this would work better, it's hard to really listen and just when someone comes out of nowhere. So you trust us and you're able to dedicate yourself to make things better, even if it's coming from someone that just came out of nowhere. You still have faith and that makes the whole difference. We're not able to do our job without your help and support. So your dedication that you talk about, that you want more with your life and more with your education and specialty. That's why these people saw something in you and supported you, because you can see that difference. There's many, many nurses in the world, but you can tell when someone is worth that time and effort because they will give back 1,000 more than you even give them. And you are the in charge, so obviously you were chosen to be in charge of Pete Med, in charge of all the other nurses. Is that a tough job?
Yeah, actually, me being an in charge, it was a tough decision. When they call upon me to ask, I face it hard because I've never been an in charge before. And me, that time they said I should be the in charge. It was just my 1 year in the professional work. So I was like, how? So when I thought of my mission and why I'm here, I say it's good to go with challenge because I know that work of in charge, it is so challenging. So I can accept the challenge because challenge sometimes can make you strong. So it has been challenging, but we are catching up with it like that. In these countries, some of the things, especially some of the things to do economically or financially, because the work of an in-charge, you remain there every time there is need of your service in the hospital. Even when you are off duty, you can be called and go.
I know, I've called you before when you're off duty.
So it has been challenging, but through challenge, we can become strong. I love challenge, especially when you came in with these forms. Those forms, it was hard for us to understand. But when we took time to go through it, the medication sheet was the first one, and now it is the pediatric admission form. And it has summarized almost everything, and it is the best now. You see, if you were to neglect, we will have not know how best it is. Those two forms, all those forms, they are really helping, because some of it is saving time.
Yeah.
Because some of the things you do is circling and other things, then things are all there. So it was so challenging, but as always, human beings, some take time to understand, some are rigid to changes.
Yes.
But one thing is, as a medical personnel, as a nurse, we don't need to be rigid to changes.
Yeah.
Nursing changes every minute.
Yes.
Procedures are changing every minute. So if you are to remain with the one you learned since, you may not get the correct thing.
Yes.
So which means when new things are introduced, take time to study it and then go through it. So as per now, I think, though there are some challenges, but I believe by the end of this August, we shall really be equipped with all those challenges.
You're right. Life is dynamic. You should not be rigid, otherwise you miss. Even for us, even doctors, medicine, guidelines, always changing.
Yeah, only what I would like to talk about is our department is really complicated in pediatric, which means there is really need of manpower. There is really a need of manpower, because based on our numbers as nurses there, it's really not helping much, because we take more time with more work.
Yeah.
Like you can work from morning up to evening with the work throughout. The work is heavy and there is long duration of hours to be spent. So the only recommendation I will have is, if we can have very many nurses, it can improve the quality of care.
Yes.
The quality of care. Because when we are few, like when we are just with a bio on duty from morning up to evening, there are some of the things you can prioritize.
Yeah.
What can kill patient first, you work on. But there is a need of this nursing care, all those things, holistic nursing. But you cannot perform when you are understaffed. Then there is a burnout also. So we really encourage, if we can have very many people in the field with us, either volunteers or permanent staffs, it can really help us to produce the quality work to our patients.
Exactly. It's nice to have a nurse on rounds who knows what the plans are, but then you also need to have the nurses at the same time to take care. It's difficult to be on rounds if you have other things you're supposed to be doing.
It's really hard when you are few on the ground, but when you are many, even you can divide work.
Yeah.
When you divide work, each person will know which task you are supposed to follow, and then you can go with it. When we are really on the ground and we know what we are here for, you can deliver the best thing, which means having nurses is of two categories. Some of them who don't know what they are doing, then some of them are, especially like my brother here, Abio. If two are like him, this hospital really will be high, because he's hardworking.
Yeah.
And he used to be my role model. If Abio can work like this, because thoroughly Abio can come and work seriously. And you cannot know when he's getting tired.
Yeah.
So if we can have 2 to 3 like that, really, we can help each other.
Yes.
Yeah.
He was a good role model for you, obviously, because you both do so well, and you work well together, which is important too.
Yeah, he's good.
Yeah. So anything else? Any final words from either of you?
Yeah, I thank you for taking this time to speak to us. We really appreciate that. I personally appreciate all what you have been doing here, all the life of the patients you have served, because I've been here in the past months. I saw what was happening, and now I'm seeing what is happening. So I really thank you for coming, and I thank CMB for sending their volunteers. We really recommend it if they can, at least someone like you, maybe to bring permanent. Because when you go like this, some of the people may relax and they go back to the same practice. But if you are still on the ground, no one will go to the practice of those days. So we really thank you for being on the ground. And we still request if we can have such a person like you as a permanent staff here. That one can really help this community. This community is in need of help.
Yeah.
It has never been before in this hospital to have a pediatrician as a specialist. We have never received, maybe during those days, but I've been here attached to this hospital. I've not seen a pediatrician here. So we really thank the initiative it was taken to bring you here to this part of South Sudan.
A large percentage of children as patients here. It's a good idea to have a pediatrician if they can find permanent, but I can come whenever I can come, and I hope people will listen to what I have to say when I come, and when I go, I hope you can remind them to continue what we have been teaching.
Yeah, we can also say, if you want to conclude, thank you also for the initiative also you took, especially for interview to express ourselves, also share some challenges, also advantages, our personal challenges from home, from workplace. I remember, as I've mentioned before, we did not had like this before as volunteer, maybe giving chance for us to also express also like the way you did is very important. As we have learned, this hospital need consultant like pediatrician like you in future, maybe with the help of Katon, the of Tomura Yambio and CMB, if they can also hire a pediatrician permanent, is very good, can improve quality of service. And then also other department like also medical unit also specialists. The same happened to maternity. Dr. Taban is there now. Most of the thing, though maybe we are in health session, he focus in his part, but some of the thing, because he was been working here before, he also give, if all people like him, maybe in his department, it will be so better.
Yeah.
Then it also give chance for us to learn also other things, though in the duration volunteer have not come, they can also stand strong, then we'll also learn things. As my brother mentioned, the admission form is very fast. A Syrian nurse who can also do a perfect admission based on sign and symptom, is very perfect. Like I've seen today, one of the student clinical officer, he admitted, I've seen them very perfect. Very perfect. Meaning
it helps you.
Yeah, it helps. It is when you are alone, you master the form. You can admit very fast.
Yes.
You admit very fast. Yeah, that is very important. The issue of understaffing, it's not started right now. It has taken time. In the one time I also read in the books like a quality work for a nurse to give, if a ratio for a nurse to person is 1 to 8. That one, if if there's no complicated one, they are there, but they are fair condition. That one, a nurse will perform good, maybe quality, whatever. But sometimes when a serious case, like in ICU, one person can disorganize the whole, even if you are 2 or 3 sometimes. Meaning there is a need for nurses, because the hospital itself can start with nurses and midwives. They are very important, but for time of midwife, the numbers are okay, but nurses, we ask in future if there's maybe the issue of funding, if they can also give hand to also add number of nurses, then it will be also good. I really thank you very much to bring also the motive to select the staff to also talk is very important, because you also hear from us how we become up to this level you have had, and then also our plan you also had. If anything, maybe where you go need also maybe what we have explained, you can also try to ask, are we having our plan still in our mind? Then you can still add. That's very, very important. Thank you.
People should know your story from you. And
it is very important. Thank you.
No, thank you. Thank you for welcoming me and allowing like my job to be easier, knowing that I have people to support me at the hospital, so it's not scary or isolating, and that we can do our job better knowing that you're accepting and receiving. At the end, everybody is a human being, so it's about connecting to other human beings is really important. And when I go back, people will ask me about you, and now they can hear it themselves. Okay?
Thank you.
Oh, thank you.
We really appreciate it.
Yes. Appreciate you too.